I'm your host, Dr. William Dodd, from the East Tennessee State University Health Pediatrics Adolescent Medicine Clinic. This podcast is not intended to provide medical advice. If you or a loved one are working through medical problems related to today's topic, please consult a personal physician. I have no conflicts of interest to disclose. Today we'll be talking about an interesting topic. It's a LARC, but it's not a bird. It's a long-acting reversible contraceptive. All right, I'd like to welcome everybody to the Growing Stronger Together podcast. This is your host, Dr. William Dodd. I'm a pediatrician who works with East Tennessee State University Health Pediatrics. And today it is my great pleasure to welcome guest speaker. Soumya Jena is a second-year resident in pediatrics here at ETSU. He's from Odisha, which is a coastal state in India. He started his medical training in Mumbai and followed by a pediatric resident in Punjab, where he specialized in neonatal training in Toronto, Canada. He was impressed by the North American approach to medical training, and he's joined us here at ETSU in pediatric residency as a second-year resident, though he definitely comes in as an expert. So thank you so much for joining us.
Thank you. Thank you so much for the introduction, Dr. Dodd, and thank you for having me for this conversation.
Well, I know your specialty is little bitty babies and not as much adolescents, though I feel like you're really good with our adolescent patients. But today's topic is something that kind of brings those subjects together, because we're talking about how to avoid having little bitty babies until we're good and ready. Namely, long-acting reversible contraception, or LARCs. Can you talk a little bit kind of about what LARCs are and maybe some of the concerns that teenagers have around them or questions?
Absolutely. I think LARC is one thing we should be talking about, and as you rightly said, it prevents pregnancy and therefore it prevents creating babies in that regards. But yeah, LARC is an acronym which stands for Long-Acting Reversible Contraception, and it is recommended by the American Academy of Pediatrics and also the American College of Obstetrics and Gynecology as the first choice for contraception among adolescents. They're often called as set it and forget it birth control measures, which means that once you put it in, you just forget about it. You don't have to do anything every day. Now, this is important because we know that teenage pregnancy rate in US in 2022 is like 13.5 births per 1,000 females. Mm-hmm. We know it has decreased over the years, but still it is still at a higher rate compared to other developed countries. And therefore, the need for contraception is really important.
And we'd really like that rate to be zero. Right?
Exactly.
And, you know, I can tell you, I take like a baby aspirin every morning to help protect my heart and lungs, and, you know, allergy medicine because the trees are just terrible around here, or wonderful in the fall, but terrible for my nose. And I have trouble remembering my medicines. I can't imagine being a teenager who's, you know, playing volleyball or softball or something and has all these friends and all these activities and school to worry about and thinking about college and all this stuff and having to remember to take a medicine. That's got to be really hard.
Yeah, I mean, teenage is a very difficult age. You have to deal with so many things which are going on in your body as well as with your peers in the school, and having to add an extra thing every day it's really difficult. So I think LARC is the thing which helps a lot in that regards. But there are some misconceptions that adolescents do have regarding LARC. They have concerns regarding its safety, about its health effects and efficacy as well. And some of the myths surrounding it include infertility, cancer, ectopic pregnancy, and pelvic organ damage. Obviously, it doesn't lead to any of this, but these are some of the myths which are usually associated with it.
Yeah. Yeah, and I have I do have a lot of teenagers, and they're thinking about different ways to prevent pregnancy. And a lot of teenagers are worried that they get this implantable device, or they get uh, like an IUD, and they're worried that 10 years from now that means they won't be able to have a baby when they want to. And that's just not true, right?
Exactly. Yeah, it's not true. So, yeah, lack of proper knowledge is one of the things which is one of the factors which prevents teenagers from going into this LARC, and also parental acceptance. And they also hear some of the bad experiences from some people, which makes them think twice before they actually accept this as a method of contraception. But we are here to talk about knowledge and about why LARC is so important and so beneficial.
Okay. Yeah. When we say LARC, I think the description is kind of in the name. It's long acting, so it lasts for years. It's reversible, so you take it out and you can become pregnant if you want to. And then contraceptive, that's what it is. But specifically, what kind of methods, what systems are we talking about here when we're talking about LARCs?
Yeah, so LARC includes, one of the things is IUDs. I know many of us are well aware about IUDs. It's intrauterine device. It's a device which is inserted into the womb or the uterus of the patient. Mm-hmm. It includes that. There's another one which is called contraceptive implant. So there will be a small plasticky stick, a very small size. It will be inserted in upper arm, mm-hmm. and it slowly releases the hormone, and it is effective like for 3 to 5 years. And it goes by the name of Nexplanon, which is the FDA approved one. And the mm-hmm. third one is a progesterone only injectable contraceptive. So it means that we'll be giving an injection which will be in the muscle, and mm-hmm. then it's effective for 3 months. So these are the 3 major types of LARC, because it's a basket approach. So of mm-hmm. these 3, obviously each of them has its own pros and cons, but these are the 3 from which the teenager can choose what she thinks will be the best.
Yeah, and it is kind of interesting to note that all forms of LARCs, while they last a long time and they're highly reliable, all 3 of these are things that you would need to see a doctor, to get. It's not like a medicine that you're prescribed, or even, you can get progestin-only pills from the pharmacy without even seeing a doctor here in the past year. But these all 3 of these are kind of procedural. They need a little bit of intervention, a little bit of medical care. You need to be established with a doctor.
Yes, absolutely. I think the doctor needs to see, and obviously for IUDs, you need a doctor who has experience in inserting IUDs, mm-hmm. So that it can be inserted safely. And then obviously the implants can be inserted by pediatricians as well, who have experience in doing that. And the injection can be given by the nurse, but obviously for all of these things, it's not something which is over the counter. You have to come to the doctor and then get it.
Well, and you mentioned IUDs. Why don't we talk about those? There are the 2 types of IUD. There's the one that's got copper in it, and then there's the one that secretes medicine. So what about the copper one? How does that even work? It doesn't even have medicine in it.
Yeah, so IUDs, if we talk about the copper one, so it's a T-shaped device, and obviously it has copper, and it's inserted into the womb or the uterus by doctors who are experienced in insertion of the device. Mm-hmm. It is very effective. It's more than 99% effective in preventing pregnancy. And it works by making uterus a very hostile environment for the sperms and the eggs. Copper is released into the womb, and it creates this inflammation in the womb, which makes it difficult for the sperm to reach the egg and survive. Mm-hmm. It doesn't hurt in any way, but it prevents the fertilization of the egg and also its implantation in the womb.
Yeah, and copper, it's kind of one of those natural metallic, antibiotics, and in the same way, I think it kind of irritates any cell that's out there floating freely. It's like people who use silver to treat infections, or you can buy socks that have copper in the fabric. It just is not conducive to normal functioning of a isolated exposed cell like a bacteria or like a sperm.
Yeah, and that's the way it helps preventing the pregnancy. And
Yeah. What are some advantages of copper? Like, why would somebody pick a copper IUD?
Well, the first thing is obviously it's a long acting thing, so you don't have to worry about it every day.
Mm-hmm.
Once inserted, you can forget about taking any pills every day. So that's important. And then the second thing is it doesn't interrupt sex because it's a long acting method.
Mm-hmm.
It can be fitted at any time as long as you're not pregnant.
Mm-hmm.
And the hormonal balance is not affected. It's copper. It doesn't secrete any hormone. And
Yeah.
fertility is also not affected. And the next important thing about copper IUD is that it can be used as an emergency contraception. So
Yeah.
even after having unprotected sex, it can be fitted within 5 days.
Yeah, and I do see a lot of patients who are very concerned about any sort of effective birth control because they've had maybe some weight gain on a progestin, or it caused acne or stomach problems, or mood problems, and as a result, they're very reluctant to try a different hormonal method of preventing pregnancy, and this might be an option for them.
Yeah, absolutely.
What-
And yeah.
What are some drawbacks of the copper?
Yeah, so first of all, the insertion of the fitting can be a little bit uncomfortable or painful, but we have local anesthesia which will help with the pain.
Mm-hmm.
There can be a small risk of getting infection after it's fitted. And the next thing is if there is a chance that you're having sexually transmitted infection, when the IUD is fitted, then it can lead to more pelvic infection if it
Mhm.
is not treated. But per se, the device doesn't increase your risk of infection. And they can be a little bit longer and heavier periods. However, this is very subjective, and some women find very little difference in how their periods happen after the insertion.
Mm-hmm.
There is a very rare chance that it can make a small hole in the uterus, which is
Mhm.
called as perforation. But it's very unlikely if the doctor fitting has good experience. It's very unlikely that there will be a hole in the uterus. So
Yeah.
overall, it's very safe.
And any medical procedure really has some rare complications like that,
Exactly. Yeah.
and also pregnancy clearly is not the safest process in the world.
Yeah.
It's definitely uncomfortable and risky, in addition to all the having to worry about the child after the pregnancy if you have a mother who's not ready in their life to welcome a child. That aspect of it, it's got some real medical harms too. So I think a lot of these disadvantages that we talk about, it's also important to think about the risk here and what we're preventing. So the risks that we're preventing.
Yeah, and that's pregnancy. And teenage
Yeah.
itself is a very difficult, as we talked about earlier. So,
Oh, for sure.
yeah.
Well, and what about the other type of IUD, the type that has hormones?
Yeah, so the other type of IUD contains progestogen, which is similar. So the IUD is similar to copper IUD in the shape.
Mm-hmm.
It's a T-shaped plastic device, which is fitted in the womb or the uterus by specially trained doctor, but it releases progesterone.
Mm-hmm.
It can be left in place for up to 5 to 7 years, and it obviously doesn't release copper, but the way it works is multifaceted, if I were to say. So what it does is one of the ways it works is basically it thickens the mucus or the discharge of cervix, which is
Mhm.
which is the neck of the womb, and makes it hard for the sperm to move and reach the egg. It also makes the lining of the womb or the uterus very thin, so that it's less likely to accept the fertilized egg,
Mm-hmm.
and it also prevents implantation, or how the fertilized egg gets attached to the uterus. It prevents that.
So multifactorial.
Yeah,
And is it effective?
it is highly effective. It's over 99% effective to prevent in preventing pregnancy.
Awesome. That's great.
Yeah,
Um,
absolutely.
what are some other advantages?
So obviously, being a long-acting method, you don't have to worry every day about taking a pill. As with the other copper-containing IUD, we saw that.
Mm-hmm.
So it doesn't interrupt it doesn't interrupt sex. It can be fitted at any time as long as you're not pregnant.
Mm-hmm.
The periods can become lighter and shorter, and for some women, it can stop completely as well. And obviously, as you talked about, there's no need to remember that. Yeah, I have to take a pill every day.
Yeah, definite pluses.
Yeah.
What, what about are the disadvantages similar to the copper IUD or?
Yeah, so the disadvantages, obviously, we talked about, they're similar to the copper IUD with the fitting process itself can be a little uncomfortable or painful, and there is very rare chance that it can also make a small hole in uterus.
Mm-hmm.
Apart from that, there can be some irregular periods with it because it's a hormone releasing IUD. And sometimes it can be annoying or worrying for some women, but it settles within 6 to 12 months of insertion for most of the women.
Yeah, and the irregular periods thing. I feel like teenagers have very strong hormones. Seems like oftentimes even with hormonal interventions that contain estrogen, which should be pretty good at controlling periods, it just seems very common that periods kind of rear their head and they're spotting or cramping or other problems that are just kind of annoying and undesired. But those usually settle out over time for the vast majority of patients. The one other thing that I always tell patients if they're considering IUDs is there is a slightly increased risk of expulsion. So the IUD basically is comes out through the cervix and doesn't work when it comes out of place. So it would need to be replaced or something like that. That is a little bit higher in teenagers compared to older women, but it's still a very effective, good option for a lot of patients.
Yeah, that is true. And that's why I think after insertion of the IUD, a second visit at 4 to 8 weeks is not a bad idea, so that the doctor can actually see the threads, and then they can be sure that it's actually in place and hasn't been expelled out.
Yeah, it is a little hard to know for sure that it's there, it's working, especially when you compare it to some of the mechanisms or some of the options that we're going to talk about here in a second.
Yeah, absolutely.
What about you said earlier there's an injection that you can get?
Yeah, so there is a long-acting contraception method which is given in the form of intramuscular injection, where progesterone is injected into the muscle. Like it can be given on your thigh, on your bum, and it lasts 3 months. It's effective till 3 months.
How does it work?
So it works because it's a hormone. So it again has 3 or 4 ways that it works. It stops the eggs from being released from the ovaries each month.
Mm-hmm.
It thickens the mucus of the cervix, which is the neck of the womb we talked about, and thereby prevents the sperm from getting and meeting the egg.
Mm-hmm.
And the third thing is makes the lining of the womb or the uterus thinner, and therefore it's less likely to accept the fertilized egg.
Okay. Is it effective?
It is also more than 99% effective in preventing pregnancy.
Awesome. And what about are there some advantages to this method?
Yeah, so apart from not interrupting sex, it also helps in reducing period pain. And there can be sometimes lighter or no periods at all. And research has shown that it does give some protection against uterine or the womb cancer and also pelvic inflammatory disease.
Both things you don't want to have.
Yeah, exactly.
What about, are there disadvantages?
Yeah, so one of the disadvantages is it can disrupt the period, and it can sometimes it can cause irregular bleeding. And after the injection is stopped being given, it can take up to 1 year for fertility to return to normal. And the other disadvantages, it can sometimes cause thinning of bones, but it is not a problem for most women because the bone replaces itself when the injection is stopped. And there can be some possible side effects like small weight gain, mood changes, and some breast tenderness as well.
And I would point out that any sort of progestin-only method can cause side effects like bone thinning anytime you're suppressing the amount of estrogen that the body makes when you're having periods, and you have the ovaries release an egg. There's something called the corpus luteum that sits there and secretes hormones, and there's kind of like a hormonal fluctuation that naturally occurs with periods and ovulation. And if you're suppressing ovulation, you no longer expose the body to that estrogen, which thickens bones and also has some undesired side effects like feeds breast cancer and things like that. So there are advantages and disadvantages to a low estrogenic state. It's just anytime you're interrupting that natural process with a progestin at the expense of estrogen, it will likely have some of these side effects.
Yeah, I totally agree. Yeah, that's true.
Well, and what about the implant? How does that work?
Yeah, so the hormonal implant, it's like a small match-sized bendy stick, which is placed just under the skin in your upper arm, and it releases the hormone progesterone into the bloodstream. And it works for around 3 to 5 years. And it's also suitable if you want to get pregnant in the near future, because you become fertile again as soon as it's removed.
Well, and is it effective?
It is also more than 99% effective in preventing pregnancy.
Awesome. Does it? Why would people pick the implant?
Well, one of the things is obviously the way it works, and because it's also something which is not inserted in your uterus. It's something which is inserted in your arm, and it makes it easier for some people, because some people don't want a device to be inserted into their uterus. So
yeah, especially adolescents.
Yeah, exactly. So that way it's better than that. And the other thing is, it's for 3 to 5 years. It's not like every 3 months you have to take an injection, right? So that way it's definitely good. And obviously, like other methods of long-acting reversible contraceptives, it doesn't interrupt sex. You don't have to remember to take a pill every day. It also provides protection against womb cancer and pelvic inflammatory disease. And it also reduces the pain, the period pain as well. And it's also safe for women who are overweight, who smoke, and have family history of heart disease.
Well, and what about disadvantages?
Well, it can disrupt periods and can cause irregular bleeding. And there can be a little bit of discomfort when it is inserted or taken out, though local anesthetic takes care of the pain during insertion. And sometimes, rarely, the skin where the implant is inserted can become infected as well.
Yeah, and that's true with any procedure, I guess. But we definitely take pains to clean the area thoroughly, use sterile technique, trying to avoid any contact with anything that might cause infection.
Exactly. So it's very rare, and it can lead to minor mood changes, small weight gain, and these are the things which it can lead to. But obviously, in all of these methods, we have to remember that they don't provide any protection against HIV or any sexually transmitted infections. So we have to use a barrier method like condom, along with the LARC that we talk about, to prevent any sort of sexually transmitted infection.
Yeah, and that is always important for young people as well. for anybody who's getting any of these interventions to prevent pregnancy, we always check a urine pregnancy beforehand, just to make sure that they're not pregnant, and also add on screening for STIs, just as a matter of protocol, because it's a good opportunity to screen and make sure that everything's good.
Yeah, absolutely. Like we talked about regarding IUDs as well. So we obviously check for those at the baseline so that we don't insert IUDs if there is a sexually transmitted infection which the patient already has. First, we treat the STI and then we go for insertion of the IUD.
Yeah, and one other thing I really want to point out with any of these methods, they last a long time. They're all very effective. None of these methods, medically speaking, cause abortions or are related to abortions. These are all before pregnancy occurs. And, I hear that concern a lot from patients who are considering birth control, but may have, reservations based on different things they believe, and a lot of people are concerned that they're gonna get an IUD and then it's gonna cause abortions. It doesn't do that. It just prevents pregnancy, like any other hormonal method, and I think preventing unwanted pregnancy and planning to have a child when you are equipped to have a child those are both very ethical things, and very beneficial to both the patient and society as a whole.
Absolutely, I totally agree on that. And especially with IUD, you can also take it after having unprotected sexual intercourse within 5 days. So that's the advantage of IUD as well, I guess, over other methods of LARC that we talked about. And it's very difficult, as we talked about, in teenage. I mean, they're still learning the ways how to deal with adulthood.
Yeah.
At the same time, you add this additional thing of pregnancy. It's not easy. Pregnancy itself has so many concerns, and especially in teenage years, it's very difficult. So I guess LARC is the method which should be adopted, and we as healthcare professionals are trying our best, obviously, to get all the myths away so that people can embrace it and have all their doubts cleared.
Absolutely. It's, I think the more effective a medicine or method is, the better it is, because you don't want to take a medicine that doesn't work and wind up with an undesired side effect, such as pregnancy, or if you're taking blood pressure medicine or something, heart attack. You want any medicine you take to be the most effective, the easiest medicines to choose.
Yeah.
So, all right. Well, that was a awesome overview. I've really enjoyed our conversation today. And do you have anything else to add? Or
Yeah. So I would overall, the crux of the whole thing we discussed about is obviously LARC is very safe and effective method of preventing pregnancy without you having to worry about taking a pill every day. But the thing to keep in mind is that it doesn't prevent sexually transmitted infections. So you have to use a condom along with the LARC to prevent any sexually transmitted infection.
Yeah, absolutely. That's an excellent point. There are a lot of potentially harmful aspects of sex that aren't necessarily pregnancy. They're psychosocial, they're infectious disease issues, so relationship centered issues. So it still remains kind of a risky situation, but maybe we can all work together and take one off the table.
Yeah, that's true. And as teenager, you obviously are getting used to the new body changes that's happening to you during puberty. So Yeah, it's a lot to take. So definitely,
Oh yeah,
you don't want to add anything else.
absolutely. There's some big risks out
Yeah.
there. So, all right. Well, thank you so much, Dr. Jena.
Thank you so much, Dr. Todd, for having me.